In this video, we're going to further discuss the uses of canned sheets. Canned sheets, as mentioned previously, are essentially templates that have had information pre-filled in, and they must be created by the provider. So let's go ahead and do that right now. As we've seen, I've opened up a test patients chart. Whenever you're creating a canned sheet or doing any sort of work on a template, you usually want to do it from a test patient, especially if you are doing canned sheets. We're going to open the encounter sheet that we wish to create a canned sheet from, and we're going to click New Consultation Chart. Once we're in the consultation chart, we wish to take any of the sections for which there would be any sort of variables and default them. So it's always good, before you create a canned sheet, before you even select the encounter sheet, to keep in mind what sorts of things am I going to be building for this canned sheet. Am I going to be documenting something in treatment began? Well, no, because if I document a time at which treatment began, every time I open up this canned sheet, it's going to default to a specific time. And you probably don't usually see patients at a specific time every day, so that probably won't be too useful. Type of visit. Type of visit is something that we can use for a canned sheet. We are going to make this canned sheet always default to initial evaluation. Current complaint, current level of function, mechanism of injury, these are all things that are subjective and can possibly change. So we're not going to want to do this. We can't even use things like surgical history or history of falls, because this sheet is going to be opened for more than one specific patient, and no two patients are going to have exactly the same information. Objective is a much more typical place to do work for a canned sheet. So let's create a canned sheet for an initial shoulder evaluation. Typically when we do shoulder evaluations for an initial exam, we'll go to range of motion. Well, range of motion is something that's always going to change. So there's not too much that we can change here. However, we can default them all to within normal limits. And that way, when we open up this chart, we know that if some of them are going to be within normal limits, all we need to do is uncheck the ones that are not within normal limits and change those. In manual muscle testing, when we see a lot of patients with range of motion issues or manual muscle testing issues, go into flexion and say, well, flexion is typically 5 out of 5. Extension, let's just say that they're all 5 out of 5 for a completely healthy patient. So this way, when we go back into this initial exam for shoulders, we can go to manual muscle testing and say, well, flexion looks good, extension looks good, abduction doesn't look good, so I'm going to change that. Let's go to special tests and make sure that things look good here. The typical special tests we run for shoulder initial evaluations are shown here. Let's go ahead and say that we document. So I've selected the most normal variables that I could from the special tests provided. Let's move to palpation. And on to pain rating. Typically what we see from patients who come in complaining of shoulder pain is that pain regularly wakes the patient during the night, pain is worse in the morning, and pain gets worse as the day progresses. And this is just a possible scenario. Here we're done with our shoulder exam. We can move on to gait and make some notes in here if there are typical gait sections for someone who you'd want to document their gait, but obviously a shoulder issue is not really going to be tied to their gait, so it shouldn't have too much to do with it. So we can say ambulation is normal and healthy. Go to outcome measures. Document anything in posture. If they're using, we typically don't see patients using assistive devices for who are coming in for a shoulder injury. Of course, we see some patients coming in, but not all of them, so this would be not a good idea to document. Under vitals, we certainly wouldn't document because all patients are going to have different vital signs. Under assessment, we're not going to select a diagnosis because that is subject to change. We're going to select a prognosis of good for this patient. Let's go to plan. Under goals, short-term and long-term goals are going to be the same for all patients that come in at the shoulder. At the shoulder. Okay, and finally, if we have a scanned signature, we can come in here and click our signature so that it always comes through as well. Once we're done with this, and we can look at how this chart is coming out by clicking on the View Narrative button. Here we are at View Narrative, and we have our typical shoulder exam documentation with most things set to a normal selection. These are all things that we typically find with any patient that we pull into for a shoulder exam and evaluation. So let's navigate away by clicking on any of the links on the left side, and we'll save this chart as complete. Now here's the important part. Once we save, we have an option at the bottom of this save screen that says click here to make a canned sheet from this chart. So let's go ahead and let's click on this link where it's going to give us a section to name this canned sheet and click save. We just did an initial eval for a shoulder exam, so let's call it initial shoulder eval. And we'll also dictate what we did mostly in here, which was to set almost everything that could possibly be set as normal. So we'll call this initial shoulder eval normals, and we'll click save. Once we have the message that says canned sheet saved successfully, we'll click OK, and we can close this chart. Once we close the chart, we're back at the clinical desktop, and we just worked with the patient whose name was first name patient, last name test. And let's take a new patient this time and say that this new patient is coming in for an initial eval of the shoulder. We're going to take the patient with the first name Ima and last name test by clicking on the name and opening up their chart to access their information. Now, before we open up this chart, we'll say to ourselves, well, wait a second, I don't need to start completely from scratch. I have a nice looking canned sheet that is already geared for an initial eval of the shoulder. So let's open that up instead. This is how we open it up. We go to the encounter sheet, and we first must always select the encounter sheet from which the canned sheet is created. In this case, it was initial eval. Then we move over to where it says canned sheet to the right, which is another drop-down menu. We'll select our new canned sheet that we created just now called initial shoulder eval normals. Once we do that, you'll notice that the verbiage of the new consultation chart button now says new canned sheet chart, and we'll click it to open up this canned sheet in the context of this new visit with this patient. Once it opens up, we'll notice that sections marked in orange have already had work done on them. We can click on the View Narrative button to take a look at this chart, and as you become much more familiar with your canned sheets, this will become unnecessary because you'll already know what you have pre-selected. And you'll say, okay, well, let's go do the evaluation right now. And we'll go to shoulder and go to range of motion. And then we'll say, well, AROM flexion was within normal limits, but AROM extension is not within normal limits. AROM extension is in fact, and I unclick it to delete it, is in fact 30 degrees. PROM flexion, well, that is within normal limits, but PROM abduction, that's not within normal limits. So I'm going to remove that by clicking on this checkbox, recheck it, and say, you know what, this is actually 130 degrees. We'll go to manual muscle tests. For this patient, the flexion is 5 out of 5. Extension is also 5 out of 5. Abduction, however, is not 5 out of 5, it's 3+ out of 5. Adduction is not 5 out of 5, it's actually 3- out of 5. But everything else looks good, so I can move on. So as you can see, I'm cutting out a lot of the time that I would normally take to document if something is normal or not. These are all normal except for the apprehension instability test, which is not positive, it's negative. We'll go to palpation. under palpation, we have plenty of options to select normal. The posterior cuff is not normal. The posterior cuff is in fact inflamed, or whatever documentation you'd like to do here. Under pain rating, the pain does not get worse as the day progresses. In fact, the pain gets better as the day progresses. So we will go ahead and uncheck this, but the pain is worse in the morning and the pain regularly awakes the patient during the night. So we didn't have to make those check marks because they're already there. And as you can see, now we're done with our shoulder exam. We've completely removed the need to document every single thing in here by using canned sheets. We can take a look at what we've done by clicking on the View Narrative button again. And here is our shoulder evaluation for the initial visit with this patient. Once it looks good, we'll navigate away from View Narrative by clicking on a link on the left side. And we'll save this chart as complete. Now suppose you want to edit a canned sheet. This can seem tricky at first because if you open a canned sheet as we've just shown and you make changes to it, you're going to be keeping the original canned sheet. It's only going to save for that particular encounter. So if you want to save a canned sheet template across the board differently from how you've already saved it, if you wish to make some additions to it, you first must open the encounter sheet from which it was created. You must select the encounter sheet that you wish to edit, and then you must move to the little pencil and paper icon directly to the left of the new canned sheet chart button. Clicking on this button is going to open up the canned sheet, and from here you notice that we have grayed out information at the top and only a couple of options to save. Any changes we make from this section, and if you notice that the patient's name has now defaulted to Master Canned, will automatically be saved across the board every other time you open up this canned sheet. We can make changes to the type of visit. Say, you know what, I don't want to document that this is always an initial evaluation for this shoulder exam. So I'm going to uncheck this, and I'm now going to save this chart as complete, which will save this canned sheet. And from now on, whenever I open this canned sheet, it will no longer default the type of visit. If I wish to delete this canned sheet altogether, I would have saved this chart as void instead of saving it as complete.